facelifting has been a popular cosmetic procedure for about 50 years. And it's gotten even more popular in the last decade, I believe secondary to the social media exposure that we all have. So today I want to go over with you all the steps involved in making a decision about whether you want to have a facelift. And it is a big decision. So you have to think through all the steps of why I want a facelift, what it's about, what are the risks involved, and what kind of expectations I can have in terms of the outcome. If you're new to my channel, I'm Dr. Joel Kopelman. I'm a facial plastic surgeon, and I've been doing facelifts for the past 25 years. I can give you insight into making an informed decision on when and how and where to do a facelift. So let's discuss a few underlying reasons why you may consider a facelift. You may have lost some self-esteem, some lack of confidence in social or professional settings. You may not feel as sexy as you were when you were 30 years old. And you may just look tired and fatigued, and you don't think this reflects your inner energy level. All these reasons are actually very legitimate reasons to consider a facelift. So all these aging-related changes, whether it's the laxity of our skin, the atrophy of the mid-face fat, there's a downward descent due to gravity, and there's laxity of skin and muscle and loss of tone of our neck. A lot of this is related to genes, whether we inherited the genes that allow us to have greater longevity in terms of our facial appearance, or it may be related to some of our social habits like drinking and smoking and sun exposure. All those things can impact the aging of our face. The other thing to point out is as women age and reach menopause, the lack of estrogen in their body has a significant impact on the collagen production and elastin production of the skin. So there's a lot more elasticity. In men, their skin is typically thicker, and testosterone typically doesn't start to dissipate until later in life. So they don't age as quickly. In addition, men commonly shave, and by shaving, they're actually exfoliating their skin every day, and that actually helps to rejuvenate or keep their skin tighter and less lax. We've just talked about the basics of facial aging. Many of you have tried non-surgical treatments to improve your appearance. That's very, very popular. Lasers, microneedling, fillers, all these things can certainly improve your appearance, and I use it commonly, by the way, on an everyday basis on numerous patients who don't want to have facelifts. But a facelift can do things that these non-surgical treatments can't, and that is it can lift the face, it can elevate the face, and it can tighten your neck. There is no non-surgical treatment that can do that. So let's talk about what a facelift can do, and I want you to have reasonable expectations of what it can do. It can change the contour of your face. As I said before, you may have a kind of a squared off face due to jowls, and now by changing and lifting the soft tissue, you get a more oval, youthful look. In addition, it changes the jawline definition. You have more of a jawline definition between your jawline and your neck. The neck is obviously tighter, the skin is tighter. You may have a reduction of the amount of fat underneath your neck, and there's a vertical lift to the entire face. In addition to actually the facelift itself, I do fat grafting as part of the facelift, which restores the volume that you can lose in your face with age. Sometimes I actually use a chin implant instead of fat on your chin or on your cheek, but most of the time I inject your own body fat obtained either from your belly or your hip, and inject it prior to doing the facelift actually itself. I inject this fat in order to reestablish the amount of volume that you've lost. Facelifting as a technique has gone through a huge evolution in the last 50 years. Initially, people were just doing incisions around the ear and tightening a little bit of the skin and trying to hoist up the neck by lifting it from the skin surface alone. And that failed because it created like these waves and kind of a wind-blown appearance, as well as a unnatural contour to the face. The later evolution showed that the face should not be pulled back horizontally, but should actually be pulled vertically upward. It gives a much more natural contour to the face. So all of these developments have improved the outcome of the facelift in terms of giving a more natural appearance and the longevity of this procedure, because the deep plane is tightened, not just the superficial skin layer, gives a greater longevity to this procedure that can last typically 10 years or more. Everybody ages differently. The average patient is 10 years, but I've seen patients last 20 years and they still look good. Yes, there's a little bit of laxity in their neck, but overall their appearance is much improved even 20 years later. So when I'm performing a facelift, of course, it only addresses the cheeks and the neck and the jawline. It doesn't address the eyelids or the brow. So not uncommonly, I recommend that people have brow lifting and blepharoplasties around their eyes to improve that area of the face. That's not even approached by doing a facelift. It's not improved by doing a facelift. A facelift is down here, the brow is up here. It's an entirely different step in the procedure. So those are additional steps. In addition, I don't want you to think that the non-invasive procedures like lasering, microneedling, and chemical peels that other people recommend aren't useful in a facelift patient. Those can be like the icing on the cake. They can improve the exterior skin quality, improve, blood vessels that are growing on your face, for instance, that may be due to sun damage. Those are additional steps that are commonly necessary to enhance the final result. So who's a great candidate for this procedure? Anyone from their late 30s, say, to their mid-70s, who's in good health, who's not on blood thinners, on a lot of anti-hypertensive medication, doesn't have significant diabetes or health issues. Those are the people that I'd say are ideal candidates. And I have rejected several people who've come in and requesting a facelift because I felt their health was creating too much risk for them to undergo a procedure like this. This procedure takes approximately 4 to 6 hours to perform, depending on how many steps we have to add or subtract, and therefore they have to be in good health to undergo this procedure. I want to emphasize that you have to have an adequate period of time that you can set aside, a window of time which you can take off from work or your social calendar so that you can recuperate. And now, initially, yeah, the sutures come out after about a week, but you still have residual swelling, some bruising, and if you had fat grafting, it could take weeks to months before it all settles down. That doesn't mean you can't go out and wear makeup and so forth, but recognize you need a window of time to recuperate. It's not a 5-minute procedure and it's not a 5-minute recuperation. So you have to be prepared ahead of time. In addition, I want to emphasize that if you have a major social event coming up like a wedding, you shouldn't think about having a facelift at least 4 to 6 weeks prior to that major event. You need enough time to recuperate and for the swelling and bruising to go away. That's my recommendation. Many of you are going to come into the office very excited with the prospect of doing a facelift, and that's great. However, I have to always caution everybody who walks in, because we have to discuss the reality of the rare possibility of a complication. And the complication can involve bleeding, infections, and nerve injury. Fortunately, these are relatively rare occurrences. More commonly, there's usually a problem, say, with an incision that doesn't appear to be perfect. That's not an uncommon problem because there's a lot of incisions that are made, and healing sometimes is dependent upon a lot of factors that are out of the control of the surgeon themselves. This leads me to talk about who should be doing the facelift. A person like myself who has 25 years experience doing facelifts, we understand the anatomy and all the ramifications of the procedure itself to keep you safe and mitigate the risks involved in surgery. You should be seeking someone who really has expertise and experience in facelifting, and that's the person you should choose to do your facelift. I hope you found this video on the aging face and facelifting to be informative. If you have any further questions, please leave them below. Please subscribe to my channel to provide further information on facelifting, which I will go into in greater detail in the future. And I look forward to seeing you again in my next video.